On me doing my PO administration, first I'm going to verify the doctor's order on the MAR. I'm going to check for any allergies that the patient could have, and I'm going to perform hand hygiene. After I do that, I'm going to gather my supplies. I have my cup of water, my paper towel, my spoon, my applesauce, which is mayonnaise, my liquid medicine, my multi-dose medication, my graduated cylinder cups, and my Sophie cup. I don't have a pill crusher or a pill cutter. After I gather my supplies, I'm going to check the correct drawer on the correct cart. Then I'm going to check the correct medication on the correct drawer. Then I'm going to check the correct medication on the MAR to make sure that it is correct. After that, I'm going to read the MAR. I go from top to bottom, from the first page to the second page, and from the MAR to the drawer. After I do that, after I make sure that the MAR is correct, I'm then going to go to my labels on my medication. I have to make sure that it is correct. So whenever I go to check my medication 3 times to compare it, I check it whenever I get it from the storage area, before I open the container and before administration. Okay, then I'm going to get my medication and put it in the correct cups on the MAR and make sure that is correct. Then I'm going to go to my multi-dose medication. So I have this right here. I'm going to put the label on my hand. I have my Sophie cup right here. I'm going to take this off. Let's say that my order calls for 2 ibuprofen and I accidentally get 3 in there. What I would do is I would just, if it hasn't been touched or out of the cap, I would put 1 back in there. Okay. Then I would get this and I would put it in my Sophie cup and put my top back on there. After I place my medication in my Sophie cup, the high alert drugs are Lanoxin and Digoxin. And Lanoxin and Digoxin, that's the high alert drugs. And the 4 classifications are anti-arrhythmics, anti-coagulants, antihypertensive, and insulin. Okay. After I say my high alert drugs, I'm gonna go to my pill crusher. Okay, on my pill crusher, I have to make sure that it is clean. I would put my cup inside of my pill crusher, and I put my medicine inside of my cup, and then I put another Sophie cup on top of that. Then I will crush my medication. I will get a teaspoon of applesauce and I will put it into a graduated cylinder. So like I didn't touch that on the inside. But I'll put it in a graduated cylinder and I would put a teaspoon of applesauce in there, and then I would get my crushed up medicine and I would pour it in there and I would mix it up in my graduated cylinder. Okay. After I mix it up, I would make sure that my dosage is correct. I would verify it with another licensed personnel and document that I verified it with them. And then after I do that, I'll go to, I will clean it. I will clean my I will clean my pill crusher after I crush my medicine up, and I'll be done with that. Then Another thing is what you would not do. You would not crush intercoded or time-released medications. You would not crush them. Now I'm gonna go to my liquid medicine. Pour my liquid medicine. Okay, so on my scenario I know after this is talking about scored. It's talking about cutting tablets. Well, cutting tablets, you don't cut scored tablets. I mean, you only cut scored tablets. And if you have anything left over, you would discard it per facility policy. That's for cutting tablets. But it don't have to be scored tablets. But with my liquid pouring medicine, I know dosages is right afterward. And this is where I calculated my dosage. So I had an order for guaifenesin, 150 milligrams per mouth for cough, but only had available guaifenesin 100 milligrams per 5 milliliters. So what I did is I said 150 milligrams over 1 times 5 milligrams over 100 milligrams. I got 750 over 100, and I got 7.5 milliliters. So of course I would double check myself and get also another licensed nurse to check it with me so I can make sure that is correct. Okay, but with pouring medications, I would put the label in my hand. I would twist it off. Now, I would make sure I pour at an eye level. Okay. You can zoom up on my phone on that and see. Is it showing it right? Press the 2. You see it? Is it clear? Mm-hmm. Okay. So I have that. So after I pour my liquid medicine, I would then, that's all I would do with that. I would just pour my liquid medicine in there. And so now, whenever I go to my patient's room, the first thing I'm gonna check for is I'm gonna assess my patient, and I'm gonna make sure that they don't have any swallowing problems, that recheck their allergies, and make sure they're not NPO before any procedures or labs. I would identify them by checking their ID band, having them state their name and date of birth. Then after that, I would explain the medication administration to them. I would perform hand hygiene and put them in a comfortable position. And I would put them into actually high Fowler's position. And I would give them the medication along with the 8 fluid ounces of liquid. And after I give them that medication, I would then document it. I would initial by the MAR and the time and the medication, and then I would state the effectiveness 30 minutes after the medication administration.